Hello everyone, my name is Avery and this is my research partner Harisha, and today we will be presenting our findings on our research titled A Cross-Sectional Analysis of the Impact of a Language Barrier in the Osteoarthritic Latina Population, along with the help from Dr. Greiner and Dr. Hartwell.
Osteoarthritis is a prominent musculoskeletal disorder that affects approximately 303 million people around the world. The Center for Disease Prevention and Control estimates that OA limits nearly 23.7 million U.S. adults in their daily activities. This limitation in daily activities and diminished quality of life is likely due to the pain associated with the condition, which is chronic and progressive. OA is significantly more likely to affect women and additionally present with more severe symptoms, reducing their quality of life. Given this reduced quality of life among women, the effects of OA may be compounded if cultural and language differences are present. Language barriers have been proven to cause incomplete communication and understanding of symptoms/diagnoses between a physician and patient. Thus, the presence of a language barrier is shown to have a major effect on the quality of healthcare that clinicians are required to provide. Our primary objective was to determine if rates of OA diagnosis differ between Spanish-speaking and English-speaking Latinas using data extracted from the Behavioral Risk Factor Surveillance System, also known as BRFAS. Secondarily, we wanted to investigate differences in quality of life measured through limitations in social activity, ability to complete activities of daily living, also known as ADLs, and pain scale ratings as a proxy of completeness of care between groups.
This cross-sectional study was conducted using BRFAS from years 2017 to 2020. The study population for analysis included Latina women who were at least 40 years of age and excluded those under the age of 40. Our independent variable is the language preference of our participants, either English or Spanish. In order to distinguish this, participants were given the option of completing the survey in English or in Spanish. After the surveys were submitted, they were further categorized by age. Two groups were further investigated: Latina women who answered in English or in Spanish, who were 40 plus, and another group of Latina women who answered in English or in Spanish, who were 65 plus. Then prevalence estimates for arthritis diagnosis, limitation, and joint pain on a range from 0 to 10 were calculated.
Our results show that among Latinas aged 40 plus, the odds of being diagnosed with OA were lower for Spanish-speaking women than English-speaking. However, among these 65 plus, there was no significant association. Additionally, Spanish-speaking Latinas 65 plus were more likely to report being limited by pain than the English-speaking group. The significance of these findings are shown in this table representing the odds ratio in Spanish and English-speaking women aged 40 plus and 65 plus. According to the bar graph, it demonstrates the average arthritis pain score on a scale of 1 to 10. Differences in pain score between Spanish and English-speaking groups were statistically significant for the 40 plus, T being equal to 5.25 and the P being less than 0.001, and for the 65 plus age ranges, a T being equal to 5.27 and the P being less than 0.001.
The results from this study further demonstrate the negative outcomes associated with the presence of a language barrier by depicting statistics that show a higher pain scale rating for Spanish-speaking patients. We highlight the inequalities the communication barrier creates and re-emphasize the responsibility of all healthcare providers to ensure the best quality of care. Some solutions are the incorporation of medical translators, accurate fluency testing, and implementation of cultural competency courses. With a growing Latino population in the United States, it has become increasingly important to implement these changes and improve medical outcomes for this population. Here are references, and if you have any additional questions, please contact us. Thank you so much.